So chapter name is Musculoskeletal Medication, right? So what are the medication we use in musculoskeletal problem? First one is skeletal muscle relaxant. Then we use other medication in anti-gout medication. We use osteoporosis medication and also arthritis medication. Let me explain one by one. Skeletal muscle relaxant. They act directly in neuromuscular junction or act indirectly on the central nervous system. So the picture you can see, this is the muscle and this one is the ending of neuron. Here you can see the cell body, neuron axon and dendrite. We are just going to focus this area. Just focus here. This is the synaptic vesicle, and vesicle contain neurotransmitter. And this neurotransmitter is supposed to release in the cleft. And then there are so many receptors in the postsynaptic cleft, they received and neurotransmitter work. Like this picture. Here we say this is the vesicle. Because of action potential or because of the voltage gated calcium channel, they activate and neurotransmitter release. And here is a postsynaptic cell. When neurotransmitter release from here, this is the receptor there, neurotransmitter binding site, and they can work. So the muscle relaxant basically work in this site. Directly neuromuscular junction they work, or indirectly central nervous system. Centrally acting muscle relaxant depress the neuron activity in the spinal cord or brain. Peripherally, the acting muscle relaxant act directly on skeletal muscle and interfering with calcium release from muscle tubules and thus preventing the fiber from contraction. So you can see this one is called calcium channel. This is calcium channel. So if we block the calcium channel and calcium does not release, they interfere with the calcium release, and calcium is the important component of muscle contraction. So when muscle does not contract, we call relaxation, and skeletal muscle relaxant work on calcium channel blocker receptor or channel. So skeletal muscle relaxant are used to prevent or relieve the muscle spasm and treat the septicity. Septicity associated with spinal cord disease like acute painful musculoskeletal condition and also chronic debilitating disorder such as multiple sclerosis, brain attack, or cerebral palsy. Our chapter name musculoskeletal. So bones and muscle, they work together, right? Combination work. Now here, what are the drug list we use or act as a skeletal muscle relaxant, right? Keep it note, we are going to focus the skeletal muscle, but we have a three kind of muscle in the body. One is cardiac muscle, right? So we're not talking about the medication work on the cardiac muscle. We're not talking about the smooth muscle. Smooth muscle like GIT. GIT is called smooth muscle. When you eat something and after your deglutition, you can't stop your GIT. Please don't digest my food because it is not your control. So your cardiac muscle or smooth muscle not under your control. It is involuntary. But the skeletal muscle, the muscle in your hand, the muscle in your legs, it is under your control. If someone put the heat on your hand, you have to withdraw your hand because your skeletal muscle your under your control, right? So we are going to focus today about the medication that work the skeletal muscle relaxant we called. So what they are, what are the medication name? First of all, baclofen or cyclobenzapine, dantrolene, diazepam, and methocarbamol. So I mentioning the name what is frequently asking in NCLEX board exam. So imagine diazepam. It is the it is tranquilizer. It is the medication we use for anxiety. Psychiatric medication can work as a skeletal muscle. So one medication, two kind of uses, right? We can use for anxiety. We can use for stress. At the same time, they have an effect of skeletal muscle relaxant effect.